Hi, everybody. My name is Faith, and this is Coping Together with Mental Health Association of Central Florida. I'm very excited for today's topic, which is trauma response in healthcare workers and first responders. And with me to talk about this, I think is one of the perfect people. I'm speaking with Dr. Deborah Beidel, who is the head of UCF Restores. And well, you can tell us a little bit about yourself, please.
Oh, thank you very much for having me join you here today. I'm really excited to speak about this topic. I am Deborah Beidel, and I'm the director of UCF Restores. One of the things is sometimes people don't quite know what UCF Restores is. And, to put it in a nutshell, we are a clinical research center that is on the campus at the University of Central Florida. We do have a clinic, and our goal is to change the way that people think about, diagnose, and treat post-traumatic stress disorder. So within UCF Restores, we have three really connected parts. We have our clinic where we do evidence-based practice. We do research to try and refine treatments and make them even better. And then we have an educational component that allows us to train the next generation and also train master's level clinicians.
Wow, that's very interesting. Thank you for elaborating on that, especially for our viewers who aren't very familiar with UCF Restores. And so I guess I'll kind of start our conversation today with, obviously, with everything that's going on with COVID-19, a big concern in our country and in our world, I think, is how this is impacting the people on the front lines. While it does affect people who are working in any kind of area like a grocery store, we also want to talk about today the people who directly deal with clients and patients who have been positive or are positive for the virus. So can you kind of tell me a little bit about what your thoughts are on a trauma response for first responders and healthcare workers, not even necessarily related to this, but in general?
Thank you. That's a really good place to start, because I think it's very clear that all of us in our lifetimes are going to experience some type of trauma. And for me, what I always like to tell people is please don't immediately make the connection that just because you've experienced the trauma that you're automatically going to develop post-traumatic stress disorder. But one of the things we do know when we look at the literature is that the people who are most likely to develop post-traumatic stress disorder are those who were the closest to the event. So if we take something like 9/11, the people who were in the towers, at the base of the towers, the people who are at the Pentagon, they're the ones most likely to develop some kind of negative effect after the trauma. The same thing after the Pulse nightclub shooting, that the people who were there, the first responders, they were actually at the event. So that's one thing to keep in mind. I think another thing that we always have to keep in mind about trauma is, what are the likely results? So what if you have had a traumatic event? How do you really respond to that? So the typical reactions to trauma are really things like feeling fearful, experiencing problems with sleep, experiencing problems with eating, problems with concentration. And I know very early in your series, someone spoke about all of these. So I'm not going to go into detail with them, but I always think it's good to just have that reminder.
I completely agree with you.
Yeah,
just good to have that background.
Yeah, it's a typical event. So, it's a typical response to a very unusual event, is the way I should say that. And then another thing to keep in mind is that a lot of people will recover without any need for treatment. The most common response to trauma is what we call recovery and resiliency. So people will have a short period of time where they will feel anxious and maybe have some trouble sleeping and trouble concentrating. But after a few weeks, that begins to go away and they begin to feel better. And that's very important to remember, because sometimes if you do trauma treatment too early, you can make symptoms worse. So what we always want to do is wait and see what the natural recovery will be before we go in there and try to do things that may end up making symptoms even worse than they were to begin with. Now, The types of events, well, I'm thinking the types of events that we're experiencing now are the ones that are most likely not to go away very soon. So this is like a very weird traumatic event that's going on for months. So we don't really know if everything I just said is going to hold up for trauma, but that's what we know. So when we talk about first responders, we talk about the fact that at least 85 to 90% of first responders have experienced a traumatic event that bothers them in their career, right? And that makes sense, because what's a first responder's job? For the most part, it's responding to trauma, right? It's responding to accidents, murders, whatever. So unlike the rest of us who may have a traumatic event once or twice in their lifetime, this is their job. So it's more likely that we're going to see the effects of trauma and post-traumatic stress disorder in this.
Just from the sheer amount of trauma that they're exposed to every day.
The sheer number of traumatic events that they experience, right? I mean, firefighters are cross-trained anymore as EMTs, right? And they go to fires. We don't hear about fires very much anymore.
Yeah, that's true.
Because fire protection is so good. So what they go to a lot are emergency calls, right? Heart attacks, accidents, something like that. So we learn that that's common. Even among our telecommunicators are the ones who answer the 911 calls. Mm-hmm. They hear trauma after trauma after trauma. Again, that's their job, to emergencies. So we have to think about that. Now, with respect to COVID-19, some of the traumatic events and the concerns of first responders are really these ideas that every call they go to might be COVID-19, right? And particularly in the beginning when we didn't really know. So there was always this fear or worry that they might contract that. And then if they did contract it, they had to quarantine, right? They had to quarantine in a hotel for 2 weeks by themselves. So they couldn't go and be with their family. So
which would add to their anxiety, right?
Makes it worse, right? You know, but if they would go home, if they didn't know if they were positive, their worry was, what if I go home and infect my family? And then if they find out they're positive, it's like 14 days, I can't even see my family. So that's really a lot of the challenge. They're also responding to a higher degree of domestic violence calls, which are always bad, right? And they're seeing a higher degree of suicide. So they're experiencing more of those two types of calls. Then with the medical personnel, what we're finding out is they're witnessing so many deaths, right? And so there's this whole thing about they're the person who shares a dying person's most intimate last moments, right? Because the family can't be there. And so it's a medical professional who patient after patient after patient has to sit there with an iPad or a cell phone listening to a dying person talk to their relatives for the last time. And as one hospital worker said in New York City, you know, she's like, I'm not the type of person who can do this and walk away. So after this, I have to go find a secluded hallway and I have to cry. Yeah. So there was just a big study that came out about medical personnel in China, and there were like 1,257 hospital care workers. Half of them were in Wuhan and half were in the provinces around. And what they found was that 50% of the hospital personnel, the medical personnel, had increased symptoms of depression. 46% had increased symptoms of anxiety. 34% had insomnia, and 71% said, I'm just distressed. This is, I don't know how to label it, but this is really bothering me. Those are really high numbers, and we've got to worry about that because that's going to be a problem going forward. So what can we do? One of the things we can do is we can think about things like peer support, because we have to remember first responders and medical personnel, those are the helpers, right? It's really, really hard for the helpers to ask for help, right?
Yeah, because you're used to being the person that's there. So do you think that some people in that they almost struggle with the concept of feeling weak or feeling like they're not doing their job right or something along those lines?
They worry that they're not doing their job because, unfortunately, and not to promote our Facebook page, but we just had
No, please
yesterday. We
do.
just had a discussion yesterday with one of our therapists who used to be a first responder, and she talks about this very issue of stigma and the fact that in the training they're taught you can't let this bother you. Right?
Yeah.
Well, I want to ask a question. What kind of person can listen to 12 people who are dying speak to their relatives for the last time and not let that bother them? That's not the kind of person that I want working with me, right? I don't want someone without a heart, right? I want them to feel some emotion. So it's an unrealistic expectation that we put on them. And Chief Neisler from the Maitland Fire Department, who works with us, said all she heard her whole career was, suck it up, buttercup, you know? You don't let it bother you. And that's not what's happening. But peer support, which we have training programs for first responders, peer support is an excellent intermediary step between I'm feeling distressed and I don't know what to do, and no, I'm not crazy, I'm not going to see a shrink, right? Peer supporters are trained to talk and have those difficult conversations. So one of the things that we see first responders and medical personnel reaching out to are peer support teams that might be at the fire station or at the police station or even in the medical community. So the other thing I want to say about trauma is not everybody is going to have the same reaction, like I just said in that site in China. So again, don't think trauma, PTSD. It might be trauma, depression, trauma, substance use, right? Trauma, anxiety, and then trauma, PTSD might be the last one. Now, it's not quite clear how some people go one way and some people go the other way, but we have to think that people are going to have different responses because that means different treatments. So we have to think about that in that way. And, you know, I just want to say, unfortunately, we've just heard about another suicide. This one was in Florida of a medical person who couldn't take it anymore. And you know what he said to his family before he left? He said he was working on the respiratory unit. And he said, all I can hear at night in my mind are the signals that the respirators aren't.
Oh yeah, that's not working.
Right? It's not working. He said, trying to help people with COVID-19 who are very serious, it's like trying to push air into cement. That's what happens to the lungs. And he said all he could hear at night was these alarms going off. And it reminded me of the Pulse first responders and the people who were in there that night. All they could hear were those cell phones ringing, right? And over again in their dreams, those cell phones that just kept ringing and no one answered it. So these triggers of trauma that lead people to think, unfortunately, that suicide may be the only answer to that. So what I want to do, and I'm going to stop for a minute then, and we can ask some questions, or you might have some questions, but you know, what I want to say is, since the night of the Pulse shooting, we have treated over 333 first responders. Now, that's not all been because of Pulse, but it has allowed the community to understand that it's okay to ask for help and that there are places available where you can get help. And so I want to reach out, if I can, to all the first responders who might see this, all the medical personnel who might see this, and say, it doesn't mean that you can't do your job if you're bothered by an event. It doesn't mean that you're weak. It means that you've seen things sometimes that no one should ever have to see, and yet you do it because that's who you are. And so please, if you're having trouble, please reach out for help, because we need you strong, we need you well, we need you to help the rest of us. So please, there are good treatments available. One thing that's important is to find a therapist who is culturally competent in helping first responders. We get so many calls from people who say, my therapist just fired me. what do you mean your therapist fired you? And they say, well, the therapist was more upset by the traumas that I was telling them about than I was, and I had to consult therapists. So we at Restores have made sure that all of our therapists are what we call culturally competent. They've gone through the Florida Firefighters Clinician Awareness Program. So they've spent 2 days with the firemen. They know about fire because they've had to go through a smokehouse. They've had all these things. Our therapists have also had ride-alongs with the City of Orlando Police Department because we want them to understand the job, because only by understanding the job can they provide the best care. So again, find someone who understands the job and they'll find a good therapist.
I think you make a really good point there, and I appreciate you kind of enlightening on that, especially with the cultural competency and awareness. And one of the things I want to ask you, going back to peer support, for some of our viewers, they might be a little confused about what peer means, because when we're growing up, we think peer just means people our age. Can you elaborate a little bit on what does peer support look like with UCF Restores?
Peer support is a training program that we do, but what a peer supporter is it's someone who has the same job that you have or is in the same environment that you are, but who has been specifically trained to recognize signs of distress in someone. And also, they're not a therapist, but they can help talk to people about the distress they're feeling and also ask the difficult questions like, are you thinking about hurting yourself or killing yourself? And if someone says to them, yes, then they know what to do, right? Because a lot of times you ask that question and someone says, yeah, and you're like, oh, now what do I do?
What do I do now? Yeah.
So peer supporters are specifically trained. They go through workshops to understand and recognize the signs of trauma in people who may be having difficulty, the signs of PTSD, who can listen hard for those statements like, man, I don't know what I'm gonna do. Everything is piling up and I just can't take it anymore. And rather than saying only like, sorry, man,
or suck it up, buttercup.
Suck it up, buttercup. Yeah. It's like, let's sit down and talk about it because I've been where you are, or I know how you feel. So most places in Florida and nationwide now either have or are developing peer support teams within first responders. And Florida has a great system. So, and they respond sometimes if there is a suicide, or they respond to a really ugly accident just to help debrief the people who were there.
Wow. So someone who's in that role, I guess one of the questions I would have is, how do they, would you say that they go to therapy consistently or something, so that they're not, because again, you said they've had that experience and here they are and they're helping somebody through it. Obviously that must, to some extent, they have to have their own way of dealing with those emotions. What does somebody who's in that kind of role do to protect their own mental health?
They will often reach out to another peer supporter. Or they will often reach out to a therapist. Not all people who are peer supporters are in therapy, but they will often reach out. We sometimes have people call and say, can I just talk to you about this thing that just happened? I just need to debrief with somebody and I don't want to go into the details with my wife because it's too gory. So they will take care of themselves too. That's the biggest thing. So.
Okay, well, thank you for that clarification. I appreciate that for sure. One of the questions I have for you, and a lot of this goes along with, those of us who aren't necessarily on the front lines or being first responders, a lot of us have loved ones who are doing that kind of thing. And we kind of touched on this in one of our previous videos, but I would like to talk to you. If someone has a loved one and they're kind of worried about them, and they start to maybe see signs of what could look like trauma reaction or PTSD, what advice do you have for them on supporting their loved one? Because like you said, there is a stigma with, well, they think, they're going to think I can't do my job, or they're going to think that I'm weak, or whatever that may be. What advice do you have for us to support them?
Sure. If you're in the police department, you might worry they're going to take away your gun.
Oh, yeah.
Yeah. My advice is to start a conversation. So I would say to someone, to a loved one, you know, you're more irritable than usual. Do you want to talk to me about something? You know, or I know it must be, I can't imagine how tough it must be to be doing your job right now. Do you want to talk about it? Because lots of times what we find is people who have experienced trauma, they don't want to tell anyone else because they say, I don't want those pictures in their head. You know, I don't want to tell them what I've seen. And so, but I think just reaching out and making a connection and just saying, I'm here if you want to talk. And then you listen. You don't ask questions. You let them lead the conversation and you listen. And if you start to hear things that are really worrisome, then you say, you know what? Maybe we need to call somebody and get some advice, right? And that can be calling your EAP. It can be calling UCF Restores. It can be calling someone else within the organization where they work who understands and who can help them. And you can always ask, is there a peer support team where you are? You know, or is there a chaplain? You know, chaplains are also trained to do this. But the most important thing is to let them know that you're interested. You know something's bothering them, you're interested. And if they say, I don't want to talk to you about it, then you say, is there somebody at work you can talk to? You know, can you talk to your buddies? Can you talk to your sergeant? Can you call the chaplain?
That makes a lot of sense, and I kind of appreciate your clarification on that. I guess one of the things I want to ask as well, if moving forward, is for the healthcare workers who are having to self-isolate, like you said, self-quarantine to a hotel right now. We talked about, you know, just now our loved ones being there to support us or support those people through that. If someone is self-quarantining, do you have any advice for them, because they are distanced from their family, to keep themselves from feeling so isolated? You know, how do they maintain that feeling of social interaction?
Well, I think they maintain it a couple ways. One is doing exactly what we're doing right now. You know, using the internet. Think how hard this whole thing would have been for all of us if we didn't have the internet. So using the internet and keeping in touch that way. And a story I give, how important this is I have a friend who's a psychiatrist, and she was in the worst part of Milan when everything was so bad over in Italy. She was at like one of the worst hospitals. And I reached out to her on Facebook and I said, I don't know what I can do for you, but is there anything I can do? And she said to me, will you please just send me one little message every day? Just send me something every day so I know that someone is thinking about me. And so one day I would send her a picture of my dog, or the next day I would send her.
I was hoping you were going to say a picture of a pet or a puppy or something.
You know, I was at the beach, and so one day I sent her a picture of the beach. One day I sent her a song I heard and thought, this song is for you, because it was about first responders. But it's the idea of those little touches frequently that will make such a big difference. And so if you know someone who's quarantined, I would say, get their regular social network around them and have people reach out at different times. It doesn't have to be anything more than, hey, I was thinking about you, you know? But that will really lessen the isolation.
I appreciate that. And I think a lot of times, some of us who we're not directly, like you said, we're not healthcare workers, we're not first responders. I think sometimes people worry that, oh, I'm just going to be bothering them, or I'm not going to know what to say to them. And it sounds like what you're saying is a lot of people just want to know that they're cared for, that they're not alone, and that I think a big thing of that is, you know, showing them those things. I found it for sure, being around dogs or babies, it does something where it brings you back to kind of feeling a little bit more hopeful. So I really like that you did that for your friend. I think that was wonderful.
And it doesn't matter, you know, and you don't have to like say something to help them feel better. All you're saying is, I miss you, right? I know you're there. And I'll tell you, and for all of your listeners, doing that with my friend helped me as much as it did her, right? Because I felt like I was doing something that helped her feel better. And in response, that helped me feel better. So it goes both ways.
I appreciate that. Thank you. I know I keep saying I appreciate that, but it's very informative. Well, those are primarily the questions I have for you. Was there anything more you wanted to say on the topic of trauma response for first responders or healthcare workers?
No, I think that those of us who are not in those positions need to understand, oh, there is something I just thought of.
Oh, perfect.
When we think of people who are working in the medical field, we have to remember it's not just the doctors and the nurses and the physician's assistants, it's everyone in the hospital is having those same worries, right? So it's the dietary workers, it's the housekeeping staff, it's
The X-ray tech.
Right. So we have to remember that all those people are feeling the same degree of distress. They may not be the ones there when someone dies, but they see them in the hospital. They see all these sick and dying people. We have to think about them as well as the people who are typically highlighted on TV. Not that they're not doing a great job, because they really are, but there's a lot of people who work in a hospital, and we have to think about all of them.
Actually, just hearing you say that, I've seen a couple of things on Facebook, and it's, you know, things that just go down the line, but people talking about, like I know someone from high school who's an X-ray tech, and they talk about how it is really hard on them. And you make a very excellent point that these people are having a hard time too. And just because they're not maybe directly working with the patient or anything like that shouldn't take away from the validity of their situation as well. And it sounds like that's a lot of what this is validation, and just, you know, being there for somebody to say, this is really hard, and it's okay that you're having a human response in whatever response that might be.
Yeah,
so,
there's no one response to trauma, and all responses are right.
Thank you for that. Well, that's really all the questions that I have for you. I really appreciate you coming on and talking about this, as I know it's something that has become more frequent of a conversation just in the last couple months. And as you said, moving forward, we don't really know what all this is going to look like. So it's important that we are prepared to the best of our ability to be there for our loved ones, or for those of us who are, anyone who is a healthcare worker, first responder, how to advocate for themselves and understand that it's okay what they're feeling. All of that, I really appreciate you just talking to us about it. And if any of you guys have any questions about anything, please feel free to reach out in the comments below. Dr. Deborah Beidel, very, very wonderful person. UCF Restores is an excellent resource. Please reach out to them. They also have a Facebook Live series, as Dr. Beidel mentioned. Very interesting to look at. I know you guys have videos on like sleep hygiene, all things like that. So thank you all so much for watching. I really appreciate it. And tune in next Monday at 1:30 for our next video. Thank you so much, and have a great day.
Thank you. Bye-bye.